medication administration for sertraline, and I have my orders here. So before I do anything, I'm going to do my first check. I'm going to check that I am dispensing for the right patient. It's the right time, it's 0900, the right medication, sertraline, the right dose, 100 milligrams, the right route, PO, that these are the right orders and everything looks clear. And then when I'm done, I will document. And before I dispense my medication, I'm gonna wash my hands. Okay, so now I'm gonna get my medication, and I'm going to do my second check. I'm going to check the medication, make sure it's not expired, and it is not. Once again, make sure that I'm dispensing for the correct patient. It's the right time for the orders, it's 0900. The right orders I have, the right medication, sertraline. It is the right dose, 100 milligrams. It's a pill, so it will be the right route, which is PO, and I will document everything when I'm all done. So I'm gonna go ahead and dispense the medication. And we're going to bring this to the patient. Give your medication. I'm Heather, I'm the nurse. I've got doctor's orders to dispense some medication for you. So I'm going to wash my hands. I've identified myself. I'm going to go ahead and close the curtain for privacy. I've explained what I'm doing. And then for safety, I'm going to raise the bed up and put one of the side rails down. Okay, can you tell me your name and date of birth?
Eric Carpenter, April 14th, 1984.
Okay, I'm gonna check that on his bracelet, and that is correct, and that is the right patient, so it matches the patient. So I'm here to give you sertraline, which is an antidepressant. It's going to help with the depression and anxiety that you were just diagnosed with. It's going to increase the serotonin activity for you. So I'm gonna do my next check now. I just checked that it's the right patient. I have the right orders. I'm going to once again check that it is the right medication, sertraline, the right dose, 100 milligrams. It's a pill, so it is the right route, PO. When I'm done with everything, I will document. Do you have any allergies that I need to know about?
Penicillin.
Okay, so allergic to penicillin. This is not penicillin, it doesn't interact with it, so we're okay to go ahead and give it to you. I'm gonna have you take a sip of water real quick just so I can make sure that you can swallow. Okay, great. So here is the pill. Go ahead and take this for me. Thank you. Okay, so some things that we want to look out for, because I did just give you a new medication. Like I said, it is sertraline that's going to help with your anxiety and depression. You should be feeling less anxious and less depressed with this. It can cause dizziness and drowsiness, so I don't want you to drive a car until you know how you react to the medication. You might get a headache and you might have a dry mouth. You can use a lot of mouthwash to help with that. The biggest thing is I want you to notify someone immediately if you have any thoughts or feelings of suicide. This can increase those feelings, so you need to notify someone right away. And then as the nurse, some things that I'm going to do, I want to assess his mental status. I want to assess his nutrition and his appetite. And then the biggest thing is I want to look out for serotonin syndrome. So I'm going to monitor any behavioral or mental changes. I'm going to monitor his heart rate, his blood pressure, and then I'm also going to keep an eye on any GI disturbances, so any nausea or vomiting. Okay, so I just gave you a new medication, and so I'm going to come back in 30 minutes to check on you. Here is your call bell. Let me know if you need anything before then. I'm going to go ahead and put the bed down and the side rail up just for your safety. I'm going to open this curtain for you. And then I'm gonna wash my hands before I leave. I'm gonna step outside and I'm gonna document everything that I just did, and I'll be back in 30 minutes to check on you. So, okay. Hey, Mr. Carpenter. So we just gave you your new medication about 30 minutes ago. How are you feeling?
I feel a lot better.
Okay, so nothing of concern right now. So he's doing okay with the medication. So I'm going to remember your call bells there. So let me know if you need anything, and then I'll be back in a little while to check on you again.